We do have patients coming to us sometimes in the emergency department with a swollen finger, and then when you actually look at the nail, the fingernail is actually black in color or even swollen like this. And this is what we call a subungual hematoma, usually occurs following a crush injury to the fingertip. The most common history that we get from the patients is that the finger gets crushed against the car door. And then sometimes it's associated with a little laceration over the palm of the finger. When you do an x-ray, you can see a tough fracture like so. But these kind of fractures do not need to be treated surgically. So what do we do when we see these patients in the emergency department? Depends. So generally, if you have a really swollen finger and the whole fingernail is all black and the nail is coming off halfway or fully, then usually you should do a surgical debridement at least to make sure that there's no foreign body, no contamination. And we will try to stitch the nail bed, because sometimes when there's a tough fracture like this one, it is associated with a nail bed injury, which is a nail bed essentially is a sort of a nail production center. So sometimes it's lacerated and you need to be stitched up. And so you need to stitch that up, and then you will need to replace the nail back onto the fingertip. And sometimes, if it's associated with a fingertip laceration at the pulp region, then we will have to debride the wound, ensuring that there is no infection, irrigate the wound, and then stitch that back up as well. However, in situations like this, where the nail is completely intact and the nail is not avulsed from the injury, that also depends. If it's very swollen and the patient is in severe pain, sometimes you will give a local anesthetic block to block the finger, to keep the finger numb. And then we will do a needle trephination, where we actually poke a needle through the fingernail and sort of release that blood collection under the nail. However, in this kind of situation where there's less than 50% or it's not too bad, then generally you can just treat it conservatively, leave it alone, take painkillers, and eventually it will resolve. So over time, over the next few days, you will notice that the fingernail becomes very black, and then it may look permanent, but you just give it some time over a couple of weeks. Generally, the hematoma and the black nail will slowly disappear.